Hi everyone, my name is Anita Iyer and I run Ekansh Trust in Pune. Demystifying Disabilities is a series of interviews of experts from the medical field. One of our major focuses is prevention, detection, and early intervention. And we believe that early intervention is not only for children but also for adults once a disability has been detected. Today, we will be speaking to Dr. Rajarshi Mukhopadhyay, who's an endocrinologist. Very often, we don't know about the different experts that are involved in diagnosis of disabilities. Dr. Mukhopadhyay, thank you so much for being a part of our series, and thank you so much for agreeing at such short notice to speak with us. My first question to you is, what is endocrinology and what is the connection between disabilities and endocrinology, do you think?
Well, endocrinology is the discipline in medicine where we study the different glands and their secretions in our body. So, roughly speaking, we have got about 8 glands in our body, major glands, which secrete lot of hormones, which control different part of our day-to-day, different systems of our body to enable us to go properly day to day. So it is little bit for example, most of us has heard about diabetes. So that also comes in endocrine, because diabetes is due to the deficiency of insulin hormone, and thyroid diseases also you have heard about, and that is because of deficiency or excess of thyroid hormone. And there are lot of other hormones also, like cortisol, which is very important for living. That is, if the cortisol hormone is not there, the people will die, and their excess and reduction can cause Cushing's disease and Addison's disease respectively. And then there is growth hormone, which again needed for our growth and day-to-day maintenance. So excess of that can cause a disease called acromegaly, and in children it can cause gigantism, and deficiency of that cause dwarfism. And in children and in adult, deficiency of growth hormone can cause weakness. That is, patients can feel weak without any reason unless you test the growth hormone. So in nutshell, this is study of glands and its secretion.
Okay. You have named quite a few conditions that are caused by deficiency or an excess of hormones. Can you think of any case that you have come across where it has actually impacted a patient, where it could have been prevented?
Well, to be honest with you, every day, because diabetes as such can be prevented. So if a patient has got family history of diabetes and they are obese, they are destined to develop diabetes, and also South Asian origin, they are destined to become diabetic in future. So all these people, if they have taken appropriate actions in their when they are not diabetic, that is, reduce their body weight, take healthy food means those which are low calorie but highly satisfying food, like vegetables. So these things, if they have adopted in their life, taken a lot of exercise, that is, instead of going to places on car or taxi or even buses, if they have just gone by walking or by cycling, they would have prevented diabetes. So this is every day I am seeing all patients who are coming to my clinic with diabetes, they are all preventable. At least I would say 90% of them could have prevented their diabetes if they have taken appropriate actions at appropriate time.
Okay, so what are the resulting disabilities from diabetes? Because I find that the list of 21 disabilities and conditions leading to disabilities that has been made by the government of India does not mention diabetes, whereas it mentions thalassemia, sickle cell, etc. And I definitely feel that this also should have been on the list. What are the different disabilities that are caused by diabetes?
That means I was also trained in UK, and I have come, means I in UK I was a consultant, and there we used to come across all these things. That is why this hasn't been taken or that hasn't been taken. There are a lot of reason for that. The most important reason is that diabetes affects so many people that if government declares it as a disability, then government will be in a very difficult position, because all of them has their own then the right of disabilities. So I think that may be the reason, because diabetes can lead to every form of disease in known to means most of the forms of disease, for example, heart attack, kidney failure. Then if it happens in a pregnant lady, the child can become disabled. If it happens in a lady who is going to become pregnant, that can cause severe disability in the fetus. So obviously diabetes is a very important disease, but as my experience from UK says, that lot of the disease, they cannot just simply tell that this can be declared as a disability, simply because then the government will be inundated with the disability claims benefit.
That
And
is very
also,
true.
to be honest with you, there are a lot of disabilities which the patient can still work functionally. One of them is obviously diabetes, unless they are at the end stage. So in that way also, it is not bad for the means it is ideally should be a disability. In WHO's definition, it is a disability, because the WHO, if you see the definition of WHO's for health, so health is not only absence of disabilities or disease, but also mental and physical well-being. So here the mental and physical well-being is obviously lost. So they have got disability, but for economic as well as political reasons, that cannot be declared as a disability, diabetes.
Well, that's a wonderful insight. Thank you so much for sharing. Because I do believe that maybe we should have a list of disabilities and not conditions leading to disabilities, perhaps on the list. Maybe the list has to be revised as we go along so that we know the difference between a disability and a disease that is causing it, or a condition, that medical condition that is causing it. Thank you for those insights. What is the right time to be referred to an endocrinologist? Because we don't come to an endocrinologist directly unless somebody refers us, unless a physician refers us, or any other expert refers us, medical expert. And does it happen at the right time always? Do you think people get a diagnosis from an endocrinologist, a consultation and a diagnosis at the right time?
Well, unfortunately, no. Most of the time, in India, there is nothing. In the first world country, you have got a system. That is, if you have any disease, you go to the GP first. Means at least in UK, I can say that, because I trained in UK also. So there, if you have a disease, the only option for you to go to the GP, that is general physician. So every household has got a named general physician. For any problem, you have to visit them first. And if the GP thinks that this disease is for that particular specialty, he will refer you to that specialty. And usually the specialists are in the hospitals. So that is a nice way system. But in our country, as for everything, it is all jumbled up. So here, if you have money, you can go to the highest possible doctor you have. And if you don't want to spend money, then you can go to even those who are not doctor claiming to be doctors. So
Right.
that is the problem happening here. So most of the time, the patients who come to us has already diabetic for many years, or in that way, thyroid disease, Cushing's, that's everything. Means even for, I think, for the heart doctors, if you have interviewed them, they will also tell you the same thing, that when the heart disease what is minimal, at that time, if the patient came to us, we would have prevented this or that. The same thing happens with diabetes as well. There are very few percentage of patients who, because of their knowledge or because they have gone to a right doctor at the right time, can prevent or even ameliorate diabetes or similar diseases. But mostly it doesn't happen like that.
Right. Because diabetes does cause nerve damage, it causes cataract. There are so many fallouts from diabetes also. I think if it is caught at the right time, we can do quite a bit to, prevent those disabilities from happening. My next question to you is, can endocrine problems in a mother lead to disability in a child? I think you touched upon that very briefly earlier. So what are these
Yes,
endocrine
yes.
related problems?
So most of the endocrine problems, means the commonest one I would touch, because for the interest of the audience, for example, diabetes and thyroid disease. These two diseases, the patient should be treated at least for 3 to 6 months beforehand. For
Wow.
example, for diabetes, our parameter for, currently the diabetes treatment or diabetes, whether it is controlled or not, is something called an HbA1c, which is not fasting or PP. Yes, fasting and PP are also there, but the gold standard currently is HbA1c. Now, for those who are planning to become pregnant, so please understand this word: those who are planning to become pregnant, not even pregnant yet. So they should bring their diabetes control such that their HbA1c is around 6. And in fasting and PP terms, the fasting should be less than 95 and PP should be around 140 or less, or even less, like 120 is currently being promoted in West. So these are the parameters they should bring down at least 3 months before they become pregnant. Because you need to remember, or all the audiences need to remember, is that when a person become pregnant, the day one is the most crucial day, because that the day when a single cell is being born. So all the damage, if that happens on that single cell, all the other cell will be damaged. So this is absolutely, patients don't understand this. They think that, well, first 3 months is fine. No, the most crucial days is the day when the zygote is formed to the up to the 3 months when the organs form. So these are the 3 months when diabetes and thyroid control should be absolutely critical. So as
Right.
you
Thank
can
you for that.
understand from this, is that those who have got diabetes, they have to plan pregnancy at least 6 months beforehand, and they should be in contact with endocrinologists for their diabetes and for their thyroid at least 6 months beforehand.
So in our outreach programs, which we conduct with Anganwadi workers across Maharashtra and outside Maharashtra also, we have begun now. We talk to them about, because women who are planning to get pregnant are known to all the Anganwadi workers. The network is so wide and so dense that Anganwadi workers know every member of every family in their own areas. And we talk to them about how we can prevent disabilities by having blood tests conducted even before pregnancies actually happen. Before getting pregnant, during pregnancy, that they have to go and consult with a doctor and make sure that they are tested. All the required tests are done. And what you have told me just now is so important, and we can share this with them also coming from a doctor directly. Can endocrine gland related disabilities be prevented, and how? We've already touched upon a few, but if you would like to elaborate.
Yes, but to be honest with you, diabetes. When you have got diabetes, if somebody gets diabetes, we are not treating the diabetes, because diabetes cannot be treated, because by the time you have got diabetes, you have lost about 80% of your beta cell. That is, beta cell is the cell which secrete the insulin. Now, the body is made in such a way that it tries to fight up to the last day, and then suddenly it gives away. So it is not like a machine that which gradually wear down. Our body is a different machine. So what happens is that it tries to fight until the end and suddenly gives away. So the day when somebody knows that he has got diabetes, he has already lost 80% of their beta cell. So they at least currently cannot be reverts back to normal patient, means normal person. So he will never be normal again. He will be diabetic forever. But why do we treat it? Because diabetes is a dangerous disease. It can affect all your organs from head to toe. That is, it can affect your eyes, it can affect your brain, it can affect your heart, it can affect your liver, it can affect your kidneys, even it can affect your reproductive function as well as nerves in the legs. So it affects everything. So to prevent that happening, we treat diabetes. We do not treat diabetes to cure it. We cannot cure it at this point of time, at least, what I can say.
You manage it, not
So
cure it.
the main armamentarium in our hand is to prevent the diabetes. If you don't want to get diabetes, you have to prevent it from as early as possible. So how would you prevent it? So as I have already touched upon, that being Indian, you have got a high chance of developing diabetes in future. If you have a family history, you have high chance of developing diabetes in future. If you are obese, now remember, obesity is defined medically in our country as a BMI of 23. So there are a lot of apps in Google where you can just download and put your height and weight, and that will give you a BMI. So it should be below 23. One rule of thumb is that if your height in centimeter, if you reduce that by 100, that should be your ideal weight. But that is Western. So in our country, it should be much lesser. So for example, if your height is 153 centimeter, your weight should be 53 according to Western standard. But in our standard, I would say that it would be around 50. Or currently, I am telling all my patients to reduce belly fat, because that is most important. Even if you are thin, but if you have a belly fat, which you can see in our country, a lot of people having that, that is as dangerous as becoming obese. So these are the things which you follow, that I have got high chance of developing diabetes in future. Then cut down on your calories. The most important is to cut down your calories. But how that can be done? That can be done only by avoiding oils, because oil is the most important food substance which has got very high calorie. The oil has got double the calorie as rice or wheat or anything. So first thing is to cut down on the oil and try to eat less. Now, even if you analyze your own home, you will find that all of you are eating at least 5 to 6 times a day. So morning people woke up with coffee and tea or egg biscuit. That is also eating. Number 2, then comes breakfast, then lunch. But sometimes, especially women who lives at home, they take something around 11, 12. So 4 times, then evening, then night. So this 6 times meal is absolutely not for us, because we have evolved in Africa 300,000 years back. At that time, we didn't have anything to eat like that. We didn't have any oil. We only used to take either raw or boiled, and that too once or twice a day. So our gene has evolved like this. So if you take 24 hours as the whole human evolution, then oil and high calorie food is for the last 5 to 10 seconds. So our body is not adapted to that. So you have to understand that you have to eat less as well.
So mainly it is a diet that you're talking about, as well as exercise, I think, to a great
Absolutely.
extent will also help.
Yeah,
Yes.
but
Thank
do
you.
not put lot of faith on exercise. Do not put lot of faith on exercise, because I have seen in my clinic people say to me that I used to play football, i I walk for 10 kilometers, but still how can I get diabetes? But remember, our body is very efficient. So if you walk for 5 kilometers, you are wasting, for example, about 100 to 200 kilocalorie, which is nothing but just 3 biscuits or four biscuits. So that's how we actually overestimate our exercise and underestimate our food. So we have to do the opposite. You try to underestimate your exercise. So walking 5 kilometers is bare minimum, and taking 3 times a day is maximum.
So, Doctor, another question I would like to ask you is PCOD seems to be becoming more common among young women today. They say it is caused by stress, being overworked, etc. Is this also a part of your field of work? And what would you say about PCOD and such other hormonal conditions in women?
Yes. My PCOD is currently become commoner because it is same disease as, I would say, diabetes. Without, so in PCOD you have got insulin resistance. In diabetes also you have got insulin resistance.
Hmm.
But what happens is that in PCOD you are not getting diabetes, but because there is insulin resistance, your other hormones because of insulin become overactive or underactive. So what does it happens is that there is lot of female hormones which gets overactive, and that stimulates the ovaries more than what normal it should be normally, and that causes this multiple cysts in the ovary, so which is called polycystic ovarian disease. So what we need to do is same, that is what I have just said about diabetes. So you have to reduce your belly fat first. Most important is to reduce your belly fat. Number two, if that don't help much, then we can use a medicine which is actually used in diabetes called metformin. So metformin is given to patients who has got PCOD. Now, since these are young women, they also face the problem of fertility. So fertility, along with metformin, other drugs are given to drive up their fertility. For example, a drug called clomiphene. So that is given to drive up the fertility. Then there are injections, which are pituitary hormones, which are given to more, help the body for fertility. So basically, PCOD is another phase of insulin resistance as diabetes is. And if you see PCOD patients in future, that is when they become older, they are more prone to develop diabetes. And also PCOD patients have got their family members who have got diabetes, as well as their parents, especially moms, or if even their elder sister or younger sister, they also get PCOD. And the male part of their siblings, they get diabetes or symptoms of insulin resistance, like belly fat, blackening of the neck, etc. They get also heart problems. So these are the things which are same, means the treatment of PCOD is not much different from the treatment of diabetes, except that here they need extra help for fertility, and we don't need to give medicines to increase their insulin to keep the diabetes down. That's it. That is so these two are same disease manifesting in a different way. That how it can be put.
Thank you. Thank you very much for that answer. So, Doctor, do you have any message for the people who are watching this show? Not only the lay person, but also people who are in positions of authority that can change the way medical diagnosis and treatment and consultation, even counseling, the way it happens in India. Is there any message that you would like to put out there?
Well, that's what the message is, that the message should be put across the board, especially to young generation, that do not try to eat high calorie food, and do not for unnecessarily use your vehicles. Try to use your legs. Do not take lot of junk food. And the government makes sure, must, there is one way to make this happening, is that they can tax on junk food. Because if you tax on the junk food, then there will be few people, especially who would, means for example, junk food means what that is junk food, but there may be salads also. So if somebody get a lot of salad in a cheap, and the junk food quite expensive than the salad, many of the people will go for the salads and
Right.
low calorie food. So taxing, then giving lot of advertisement in the TV, radio, as well as in the cinemas, etc., regarding healthy eating and how to make tasty food, etc., can be taught to the moms, so that the children from now onwards do not like that junk food compared to tasty and healthy food. So these are the things the government as well as common people can do to avoid this epidemic of diabetes happening, as well as more epidemic of that happening in future.
Thank you so much, Doctor, for your time and for all these inputs. I'm sure there's a great deal more that we can learn from you, and this conversation can go on forever. But in order to keep it short, I would like to thank you right now and end the interview. Thank you so much once again. Thank you, MTO Pharmaceuticals, for being our sponsors. And I hope that everybody watching this interview has enjoyed it, and you can get in touch with any queries that you might have. Thank you very much.
Thank you.